Well, Volunteers in Medicine is the only free nonprofit medical clinic that provides both primary medical care and mental health care to low-income Lane County residents who don't have insurance. But Volunteers in Medicine targets those people who just make too much money to be on the Oregon Health Plan, but certainly not enough money to buy health care insurance premiums, or they don't qualify for them for some reason. And they might be working, but their businesses or their employers don't provide medical insurance benefits. And so when you're low income and you can't afford to go see the doctor and you don't have insurance, you're in a real pickle. There are more than 70,000 people in Lane County who don't have health care insurance. And people who don't have health care insurance don't go see the doctor when things are going poorly for them, and then their medical issues turn into train wrecks, and then they do wind up in the emergency room or at urgent cares, and sometimes they're so sick because they have let things go for so long that their care is even double or triple what it would have been if they had gone in earlier. So they're hospitalized, so all the emergency care, the urgent care, and the hospitalization adds up to many, many dollars for people that are uninsured, becomes uncompensated care for those medical institutions like PeaceHealth.
There's a lot of people who work very hard, but they do not have health coverage. And unless you're really very wealthy, you can't afford to pay for it, you know. So that's what we try to do, is to meet the needs of the working uninsured. And when I say working, I mean they'd be working if they could, like they may be on unemployment insurance now. Many of our patients are between jobs too. They've been laid off, and we've had patients who become our donors once they got back on their feet. And
because we deal with so many kind of chronic issues, things that may seem kind of everyday still have a great impact on people who need to stay in the workforce, who can't afford to miss work for too long. And so when you can take care of people who present with hypertension, diabetes too, depression, linked often to another issue, obviously, or and not so infrequently something as painful as a urinary tract infection, where those things can be dealt with quickly, where medication is available, makes a huge difference in these people's lives, not just in terms of being able to work, but how they feel about living their lives. And so there are many success stories in that way.
Oh, this is a lot of situations like people just come for a regular checkup because they say they have a headache or they have a dizziness, and for them it's something simple, but then they find out that they had diabetes, and so they need to be treated, and for them it's something new, and sometimes they didn't expect that answer as a diagnosis.
It's really very rewarding to be able to provide needed services to people who really work hard to make the world go around as well, but at the moment they may be in hard times, or they're just uninsured, and that's if we didn't work for an employer who provided insurance, many of us might be in the same boat, so